I'm Dr. Hammond, one of the GP partners at Ada Health Partnership, and I'm also the sustainability lead for our organisation. One of the most effective ways that we can reduce the carbon footprint of our surgeries is to reduce the number of prescriptions of a particular type of inhaler called a metered dose inhaler. Remarkably, these inhalers alone contribute to 4% of the entire NHS carbon footprint and about 25% of the carbon footprint of your average GP practice. You may recognize these inhalers as being the ones with the small pressurized canister in them, like this. These inhalers contain a type of propellant called hydrofluorocarbons, which are potent greenhouse gases, thousands of times more powerful than carbon. For many years now, there have been a wide range of environmentally friendly alternatives, which are just as effective but don't use these damaging hydrofluorocarbons. Unfortunately, across the UK, more than 70% of prescribed inhalers are still the more environmentally damaging ones. Here's an example. A common type of inhaler, called a Ventolin Evohaler, has the same carbon footprint or greenhouse gas emissions as a small car driving 175 miles. That's one inhaler. A greener alternative, containing a powder form of the same drug, has an equivalent footprint of a small car driving 4 miles. At AHP, we have around 4,500 patients with asthma and about 700 with COPD. That's a lot of inhalers and a lot of greenhouse gas. We want to take action to reduce our prescriptions of these environmentally harmful metered dose inhalers and do our part in responding to the climate emergency that we are living in. Volunteered doctors, nurses, and pharmacists from across our 3 surgeries are holding 2 dedicated clinics in the morning at Shoreham Health Centre on Saturday, March the 9th and Saturday, March 16th. In these clinics, clinicians will be reviewing patients' individual treatment plans, looking at what greener alternatives are available, and then safely demonstrating how to use the new device. Your repeat medication list will then be adjusted, and the new inhaler will be issued to your usual chemist. Help us to make a difference and click on the link in your text to book a slot at one of these clinics. If you can't make either of these dates, please speak to the nurse or pharmacist about switching inhalers at your next asthma or COPD review. Thanks for listening.